is psychedelic therapy. So a lot of people, whenever you hear that word, might think, I have mixed feelings about it. Some might be like, wow, it's illegal, or that sounds interesting. Tell me more. So briefly about my topic, treating severe mental illness. So a lot of the normal, typical treatments that are used right now for mental illness are for less severe mental illness, and that typically is going to be like SSRIs or some other sort of antidepressant. So this presentation is really going to be talking about alternative drugs for treatments. So the next slide is going to go into an overview of that, but this really has a promising future for those that sort of need it. Here's just kind of a brief overview. So SSRI is current treatment because I really want to show you guys kind of a background of what I'm going to be comparing all these different drugs to. And then Psilocybin treatment for severe depression, MDMA treatment for PTSD, and Ketamine treatment for suicidality or also for severe depression. So these are the main four things. By far the one I spent most time researching is Psilocybin. About 10 pages of my thesis on just that. And so SSRIs are going to serve as a nice kind of base. So SSRIs are current treatment. So SSRIs are currently the most widely used antidepressant medication in the world. So many of you have probably heard of this. It stands for selective serotonin reuptake inhibitor. And it's the most commonly used antidepressant. It's used to treat depression, anxiety, and other sort of mental illnesses. But as we're going to see, there's some also downsides or some things that this sort of drug does not necessarily fill. So SSRIs are incredible for most people. Studies indicate the following about SSRIs. They treat a wide array of disorders from PTSD to depression and anxiety. So depression and anxiety are the most commonly treated with SSRIs. PTSD and other mental illnesses are also treated, but they aren't as effective toward those mental illnesses. Specific SSRIs are effective at treating specific illnesses. So SSRIs, like we said, might be more useful for depression and anxiety, or might respond better for specific people. 40 to 60% of individuals benefit from SSRIs in 6 to 8 weeks. So these are important numbers, 40 to 60%, and also the 6 to 8 weeks, I want to remember that for later. 6 to 8 weeks is about 1.5 to 2 months, and that is a reasonably long time for someone that we might be talking about with that severe mental illness. And so these are with no doubt, the best available antidepressant for treating mental health currently, and there are over 20 available SSRIs. So again, this is just going to serve as kind of like a starting point. What are we comparing the other psychedelic or not as normal drugs to? So now we're getting into different types of depression, so more treatable depression. This is what really SSRIs really focus on treating, what they treat best, and these are going to respond more efficiently, more frequently. Treatment-resistant depression, TRD, is a type of major depressive disorder that is often diagnosed after the patient has not responded to one or more treatments. So we might prescribe SSRIs to someone, and after that 6 to 8 weeks, as I said in the last slide, they might not just be responding, might have some sort of negative side effects that are really just like not favorable. And so they're going to be tapered off that, which will take more time because if you instantly taper off of it, there's side effects of that as well. So you have to repeat again, and then eventually TRD might be diagnosed. And so this leads us to the disadvantages of SSRI treatment. So primary limitations of SSRIs, often not effective for roughly 3.62 million Americans with TRD. And this is a large number of people in America. And again, these people do not respond very well to SSRIs. So can take many months for a patient to find an SSRI that works, and can take 6 to 8 weeks before that one is fully effective, which is what I was talking about previously. And again, 6 to 8 weeks, and then you have to taper off if that doesn't work, and then you have to repeat the process all over again. There are also many side or interaction effects, so there's certain drugs like I don't really do not alcohol with SSRIs safely by any means, and there are also withdrawal symptoms. So there's acute withdrawal symptoms that can be potentially deadly if you wean off of it too quickly. So this does not mean by any means that SSRIs are ineffective for everyone, and I'm not trying to say that SSRIs are not don't have a place in treating mental health. But there are gaps that need to be filled, and that's where we get into looking at the future and where this takes us. So there are promising clinical research for those in need. So next we're on to psilocybin treatment, an extremely promising research drug that could drastically improve mental health. So this is a classical psychedelic, and so here we can see in the top right, this is the mentions on PubMed, and so this is basically how many studies are mentioning psilocybin. We can see just in the last few years, this is kind of exponentially increasing, the interest in psilocybin. So psilocybin seems more incredible Studies indicate that it has been approved as a breakthrough therapy by the FDA in 2019, meaning it's only been eligible for research or studies for only about 3 years. We notice this chart has only been up there since 2020, so we can imagine 2021 and this year how much more this has grown. So extremely effective toward major depressive disorder and TRD. And as we talked about with SSRIs, this is really kind of the struggle with SSRIs that it doesn't really seem to fit with TRD. And this is kind of the gap that psilocybin fills up. So this might also treat addiction and terminally ill patients. I did not focus specifically on these, but there is research on addiction. And the reason I think it helps terminally ill patients is because people that are terminally ill typically have chronic depression and or anxiety, and that's essentially what psilocybin is treating. And so this part down here is very important. Psilocybin temporarily increases brain plasticity, which is essentially the brain's ability to more efficiently rewire itself. And so, but not only that, but the combination of therapy with this increased brain plasticity seems to drastically decrease symptoms of depression. So here we can see the combination of these two is extremely important, extremely valuable. And this is the case with other drugs we're looking at in this presentation as well. Therapy combined with the drug is better than just the drug or just therapy. So these aspects of psilocybin therapy have a strong synergy. This image is supposed to showcase the different brain networks communicating on psilocybin versus a placebo. So you can imagine like a therapist during this sort of drug experience is much more effective with someone that knows what they're doing rather than just giving someone a drug and like taking it home. That's not quite as effective. So during psilocybin therapy, this image shows this. First of all, moderate to large doses are most effective at significantly reducing depressive symptoms. So baseline here for this is for a high dose psilocybin session, and the baseline depression score is about 19. You can see it drops down to about 7, and it drops down to 6, and slowly we kind of come back up. And this is a common trend that we see, so a significant decrease within a slow coming back up, which means basically we're gonna have to have another session sometime in the future. And so, as you can see, this is very significant decrease though. Effects are not yet neuroscientifically understood, and connectedness and acceptance are increased after ingestion. So connectedness is basically one's ability to feel more connected to their environment, people around them, to their own mind. And then acceptance is their ability to accept all those things, perhaps their mental illness, and things like that. So that's what psilocybin increases. This drug becomes strongest at 2 to 3 hours after dosing, meaning these people are probably going to have to be in a treatment setting for upwards of 4 or 5 hours to be safely released. So primary limitations of psilocybin. So as we can see in this image here, I mean, just 5 to 10 years ago, there was no decriminalization of these, but now we have some progress for sure, but still, the vast majority of the U.S. has just illegal. So a small percentage describe their experience as ranking in the top 5 most difficult experiences of their lives. We can't separate psilocybin therapy from this. This is something that needs to be talked about if this sort of treatment is going to become more prominent. The two just cannot be separated. So not yet legalized for medicinal use, could be years, could be 5, 10, 15 or more years. It's hard to say, but this trajectory of research, it's a very promising sort of drug. So there's also a strong negative stigma around psychedelics and their efficacy. So a lot of you, this might be the first time you've ever heard of this sort of treatment, or you might have thought that these are just like party drugs or very dangerous drugs before. But the research is sort of suggesting otherwise. But this is something that as a country, as a society, we have to kind of get past. Long-term side effects, if any are not yet known, this is the case for all these drugs except for SSRIs. Now we're moving on to another drug called MDMA. This is also known as ecstasy, therapy for PTSD, an extremely effective treatment option for those with less treatable PTSD. And this is not technically a psychedelic, but it does sort of fall under that umbrella of less commonly used. This one's a little bit farther along in its lifespan. It's been around for a little bit longer, and it's completely legal in many states. So MDMA treats severe PTSD. You can see in the image here, this is, again, MDMA-assisted therapy. So not just MDMA, not just therapy, we're combining MDMA and therapy. So in the orange circle is MDMA-assisted therapy. 67% lost their PTSD diagnosis after just 3 sessions. And the placebo, 32%, which is, this is over double, lost their diagnosis. So as you can see, there's pretty significant results here. PTSD is a very common disorder that has a few root causes, typically trauma, some sort of childhood trauma, or any other sort of trauma is typically where PTSD occurs from. And similar to TRD, some forms of PTSD do not respond well to SSRIs. So I believe, if I remember correctly, there's only about 2 or 3 SSRIs that actually have the chance to be effective toward PTSD. And if those don't work, people with PTSD are pretty limited on their treatment options. So yeah, only specific SSRIs are prescribed. MDMA has shown to lead to remission in many patients. As we can see in this image here as well, therapy is combined. So how does MDMA work? So this is actually, I'm supposing, maybe a medical doctor, and then we have a patient here. And this is, so basically we're blocking out their sense modalities, and we're sort of focusing their consciousness inward toward maybe the trauma. PTSD symptoms often include intense fear and anxiety or trauma, and MDMA produces opposite effects such as anxiety suppression, empathy, and affection. So it's my understanding or sort of theory that the reason MDMA is so effective at treating PTSD is because the effects are basically counter to that of MDMA. So, anxiety is obviously opposite to anxiety suppression. Fear is opposite to empathy and affection. And this drug is much more effective. It's much more quickly effective than SSRI just after a couple of hours. And that's actually the same with psilocybin as well. So 75 to 125 milligrams used in active doses across multiple studies. 75 milligrams, I believe, was said to be a little more effective, so that's more like a moderate dose compared to psilocybin. High dose would be more effective. Treatment reduces PTSD for many months. This does vary depending on the severity of the PTSD, depending on other factors, maybe genetics or how well they react to the drug. So primary limitations of MDMA. MDMA is known to cause neurotoxicity in humans after repeated use. Most of this information I got was related to recreational use though, so this is not necessarily, for therapy. These people are probably using it much more frequently, we only need to prescribe MDMA once every 6 months or less, and for some people, we can see here they have remission, or they just have loss of diagnosis, so you don't necessarily need to prescribe it again after the first few sessions. And studies suggest the effectiveness of only one MDMA treatment can last for many months. Opioids are also an extreme example of this, right? So we have opioids that are prescribed for medical reasons, and opioids, as we know, are a very dangerous drug when used incorrectly, but when used properly, they can be extremely effective. And I think MDMA is sort of the same, even though opioids might be a bit of exaggeration. Minimal risk of neurotoxicity could outweigh the risk of severe PTSD. So if someone has life-debilitating PTSD, small chance of neurotoxicity might be worth it for them, depending on doctor things, stuff like that. So long-term effects not documented in depth. This is again the case with the final 3 drugs we're talking about here. So ketamine for severe depression. This is a rapid reducer of depression and suicidality, and it's actually been recently FDA approved in Indiana. We actually have clinics here in that as well. So ketamine treats severe depression. So the red square is the initial infusion. You see this is a depression scale, and we're starting at about 32. And we go down after just day 1. This is an extremely fast-acting drug to about 16 or 15. And then again, we see the same pattern where we kind of go back up. And so that is going to suggest that we need to prescribe another dose later in the future. But as we'll see, there are some downsides to ketamine. So severe depression, major depressive disorder, or treatment-resistant depression often coexist with suicidality. Studies suggest ketamine is an extremely fast-acting suicidality reducer, often unlike SSRIs. So again, remembering back to that 6 to 8 weeks. If someone is suicidal or if someone has extremely severe depression, you don't really want to tell them, here, have this SSRI, come back in a couple months. This is something that might be an alternative to SSRIs for short term. So, and then maybe get them onto some sort of different treatment plan, and then, yeah. So research also suggests anxiety and migraines can be reduced. I know someone personally that went to the clinic here in Evansville for migraines, and that definitely helped them. I didn't look much at those. I just mainly looked at TRD for my thesis. And yeah, it's been FDA approved in clinics that exist in Evansville. Important ketamine facts. Ketamine injections or nasal sprays are most commonly used. Here's one of the clinics in Evansville, and the bottom, this is very similar, as you can see, to the MDMA treatment, kind of blocking their primary sense modalities and then focusing their attention. The interesting thing about this is that an injection treatment session lasts between only 45 to 60 minutes. Also, most research papers I looked at only use injections. Nasal sprays don't really seem like a very smart idea because they're going to take those home. There's a higher chance for abuse with those. Fastest acting antidepressant I've looked at, very good for severe cases. And again, I think this would be great for a backup plan to SSRIs. Yeah, so lastly, primary limitations of ketamine. So effects last for about 3 weeks before they start to wear off. So this is really much shorter compared to the other drugs that we looked at. But again, this is also much more rapidly reducing than other drugs that we looked at. So various types of toxicity associated with frequent and long-term use. So again, I want to emphasize that this is more for sort of like recreational use. If we were to prescribe this for someone once, or maybe a couple times, there's a pretty high chance that there's not going to be extreme side effects, although there of course could be. Monthly injections might not be healthy or affordable for many, and pros and cons should be scrupulously examined by patient and medical doctor. And here's an image of some of the effects. Thank you, and any questions?
Alright, so I'm also kind of focusing on psychedelics, but particularly with LSD. I'm focusing on the downturn in psychedelic research that happened during the mid to late 1970s. Did you see that research kind of happen along with psilocybin and MDMA and ketamine as well?
A lot of my research, a lot of my papers I pulled from are more recent. I know there's some research from there as well, from before they were actually, I suppose, fully banned. I actually looked at LSD, but there was not. I couldn't find a lot on LSD. I initially wanted to do a little more research on it, but
yeah, I'm focusing on why there's so much limited research right now because of that hiatus. That there's been a decades-long hiatus in LSD research. I also had another question about side effects. So now with especially psilocybin and I'm also focusing on LSD, there's the issue with hallucinations. I mean, you get side effects as well with SSRIs, but are you weighing side effects of psychedelics and SSRIs?
I haven't directly compared the two, but it's definitely something we need to look at for any sort of treatment for any sort of mental illness. In terms of the longer-term effects of psilocybin or any psychedelic, it's hard to say because we haven't looked at them. Short-term, I feel like might have a better idea, but still not definite. But yeah, it really kind of is like a give and take. So what is the patient getting versus what are the side effects?
When you were talking about psilocybin, you mentioned that there are a small percentage of psilocybin users that rank it as one of the most difficult experiences of their lives.
Mm-hmm.
So I was wondering why do you think that is? Were those people led by licensed therapists or?
Yeah, I'm not sure if they're led by licensed therapists, and this was only one study I looked at that said this, but it's hard to just avoid that stat. It was the minority of people, but also if you go back, we see that an experience here would be about 2 to 3 hours. So a 2 to 3 hour experience could be the worst, top 5 in your life, but at the end of the day, it is going to pass, and there's no direct threat to their lives, and there is still a chance that they can grow out of that experience. It sort of depends. I feel like this is something we need to look at. If a licensed therapist could minimize the chance of this occurring, or maybe if it does occur, them being able to handle it more appropriately than letting it spin out of control. Yeah.
Have you looked into microdosing with psilocybin at all?
Yes, I have a small section on that. But so basically, if we go back here, we can see this is a high. So moderate to large doses are most effective at reducing depression. There are definitely benefits of microdosing, but it's not as pronounced, and this is probably not the ideal treatment for someone with more severe depression. Maybe for just depressive symptoms, or just for other mental illnesses or something, like the other mental illness symptoms. Yeah.
Sorry, but kind of back to the adverse effects, how you were talking about. I did read a study
research, this has been, sort of not necessarily fully proved, but you can see data that suggests this is going to help you significantly with your mental illness.
Along with that, it's not them trusting the drug. Sorry, I was hawking t-shirts for a week, plus I got a science fiction, so yay. Cough drops are fantastic. Numbing cough drops. Anyway, back to the topic again. And it's not as much the person's trust in the process, the environment with any psychedelic, they have to be under control. So what I hope we see in your thesis, and I totally understand with these talks, I mean, it's not everything of your thesis, but you mentioned that, these along with therapy help rewire. And what I'm hearing, and maybe it's my travel brain, is like, this drug does it. It's the therapy in this drug state that allows for great leaps forward. And what the drop-off is the pathways that are already there from the person in the anxiety state, the depressed state, are already wired, so they will tap back in. And so the ultimate goal of therapy is not figuring out what your mom did, but what you wired into about that and how can you reshape that approach in your life. So I hope in the paper you add that therapy session too, because that's
It's very, very important.
How much have they talked about in this research about kind of going off what Dr. Becker said, like priming the patients, making sure they're in like an optimized state to maximize the results? Is there like some sort of like standardized way in which they do that in terms of like saying the right things or coaxing them or like telling them what's going to happen or what might happen, kind of like making them more comfortable?
Yeah, it's a good question. Not really too sure, and this is still relatively new. Actually, this would be a very sort of like a dream job for me to be like a therapist in sort of a setting. So I'm not sure, but just I feel like telling them how the process goes, what exactly is going to happen, if they have fears, like toning it down. But this is still very early in its development, so it's hard to say. But yeah.
Is there any research for this in any other countries who are maybe further along than the U.S.?
I don't think so, but I got some articles from Europe, I think.
Yeah, if you're on PubMed, you'll catch everybody's. It's not just a United States thing.
I know it's early in the research state, but is there, do you think this is gonna be like an affordable way to treat mental illness? Like, is this eventually gonna be affordable to regular people?
Yeah. So ketamine, we talked about that. There's one here in Evansville. I looked at their price rates and it's quite expensive. But with that being said, this is something, especially if it's decriminalized, this is something that can become much more broad. And so with more supply, it's gonna be less expensive, I feel like. And if it's much more effective, I feel like it'd be a shame to charge so much for something.
And
so
I think the cost is the trained therapist, because ketamine we've been using for ever, and so it's really cheap. We used to use it for anesthesia for animals till we realized, oh, we were just putting them on a drug trip instead of knocking them out. So, oops, wrong, don't use that. And, oh wait, it puts people on drug trips, and so Special K became a street drug, and then we were like, wait a minute, let's look at these psychedelics again for therapeutic. I mean, psychedelics got a huge bad name when the CIA went rogue on LSD, and if you haven't dived into that, that's a really fun little rabbit hole to dive into. And so it was some social ideas of it, but MDMA, the toxin of it is just Parkinson's, that's all. It's fine. It's thick with sarcasm. SSRIs have a wide-ranging, digestive issues, sexual issues, things like that. But the rest seem to. And why does it take SSRIs so long to work?
Yeah, that's a good question. I actually don't know the answer to that. but that's one of the primary downsides that I've kind of picked on here, because these other ones all work much quicker. It's like much